If you're self-employed and turning 65, you may be in a situation where you're going to be required to take Medicare. In other circumstances, you may be able to delay taking Medicare. And this is certainly something you don't want to mess up. So in this video, I'll explain the differences. Let's begin with the first scenario, which means this is someone that is a 1099 independent contractor. You're not an employee. You receive a 1099 for your reportable income. And so in this scenario, you probably have secured your health insurance through some type of an individual policy. It could have been one through a health insurance company. It could have been a healthcare co-op. You could have gone to Healthcare Exchange and have actually an Affordable Care Act plan. But in that scenario, you have that individual policy. And so if this is how you're covered, you have to start Medicare at 65. Now, you may be married, and if your spouse is still working and covered by an employer group health plan where there's active employment and that group has 20 or more, then you actually could, as an independent contractor, actually go on your spouse's health insurance and you wouldn't have to do anything with Medicare. But if that is not an option, 20 or more employees on a company plan through your spouse, then you're required to go on Medicare at 65. And so when we have to go on Medicare at 65, what we're doing is we're using the enrollment period that is called our initial enrollment period. And what you must understand about this enrollment period is it only lasts 7 months, and that's it. So we have 7 months to enroll into Medicare. Now, that would be this example. Let's say that our birthday is 10/15/1958. Just so you know, I'm shooting this video today. It's August the 7th, 2023. You may be watching this year, next year, but the principles still apply. And so if we have a date of birth of 10/15/1958, that means we're eligible for Medicare 10/1/2023. It's always our birth month where we're eligible for Medicare. Now, the exception would be if someone was actually born on the first day of the month, then we actually move their Medicare to the previous month. But if you're born on the second day thereafter, it's always your birth month that you're eligible for Medicare. And so we have 7 months to enroll. And those 7 months are very specific, tied to our birth month. It's 3 months before, a month of, 3 months after. And so what happens here, in this example, we have July, August, and September, 3 months before we can enroll into Medicare. And when I do that, the result will be my Medicare will start right when I want it to on my birth month. But if I delay enrollment during my initial enrollment period, what happens is they'll delay my coverage. And so again, I have 3 more months. So if I enroll in October, they'll start me in November. If I enroll into Medicare in November, they'll start me in December. And enroll in December, they'll start me in January. And then the very last month of the 7, and it's January, they'll start me actually in February. So what's happening is they're delaying your Medicare coverage for a month. Now, the problem with that would be, especially if you have an ACA plan, they're not going to provide any kind of subsidy, no cost sharing, so you're going to be fully out of pocket if this is what you decide to do. So my point is, you want to be sure, if we have to start at 65, the smartest option there is to enroll those 3 months in advance and begin then on your birth month. So that's what happens if you're an independent contractor. You have to start Medicare. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. Now, the second scenario that I want to address would be if you actually own or maybe co-own the company. And so what matters in this scenario is the size of the company. And so what I'm going to reference in this particular slide is if this plan that you're covered by, a group plan that you're probably helping pay for since you're the owner, has 19 employees on your payroll or less. Now, they all don't have to be on the health plan at all. It just means 19 employees on the payroll. They could be part-time, they could be full-time, it could be a combination of that. But if this is the size of your company, 19 or less, then what happens is you have to go on Medicare at 65, just like the 1099 independent contractor we just looked at. Okay, and so you have to start Medicare at 65. You're required to. So again, you have that IEP that we just discussed. We have that 7-month window to enroll in Medicare. And again, you should enroll 3 months prior to your birth month, so your coverage begins right when you need it to. And the reason for that is this. Right now, you no doubt probably have company insurance. And so what's happening right now is if you had some kind of a claim, your company plan pays first, and you actually pay second. And what I mean by that is you probably have some co-payments or co-insurance deductible with probably some kind of a max out of pocket. So this is the way your claims have been handled up until we hit 65. But when we hit 65, what happens is this. Everything changes because Medicare says now the first payer is Medicare and the second payer is your company plan. Okay? In other words, that company plan changes payer positions. So if you don't enroll into Medicare during this 7-month window, your initial enrollment period, what happens if you don't put Medicare in the first payer position? Who do you think becomes the first payer? You do. And I can assure you, if you have some kind of a large claim, that's exactly what's going to happen, because your insurance company knows exactly you're eligible for Medicare. You should go on Medicare because they're only going to pay in the second payer position. Now, frankly, a lot of people will go ahead and even drop the company plan and do some other kind of maybe a Medicare insurance, maybe a supplemental plan or advantage plan, or do something. You don't have to, but that's what most people do, because typically it's just a better value to do that. But if you keep the company plan, it's fine. But I promise you that company plan is now going to be in the second payer position. So again, you're required to go on Medicare at 65. All right, then the third and final group I'm going to address is, again, you own or co-own the company, but the company is considered to be a large employer. And Medicare defines that by 20 employees on the payroll. And again, part-time, full-time, doesn't matter. They're just on the payroll. They don't have to be covered by your group plan, but there's 20 employees at that company. And if that's your scenario, now you don't have to do anything at all with Medicare. Okay, you're not required to, because Medicare says this is a large group plan, and when you later lose that large group plan, either through retirement or you decide to go on Medicare, you can do so, and there'll be no penalties and there's no problem. So what I'm trying to teach you is, in this scenario, you do not have to enroll during your initial enrollment period. You don't have to. Why? Because there's another enrollment period that will be eligible for you called the special enrollment period. Special enrollment period. And basically, the special enrollment period is for people that kept working or their spouse kept working and they were covered by a group plan that had 20 employees or more. Now, the key to the SEP is this. This is a little bit of a different process, and there's some additional paperwork. So what we have to do, and let me just give you the scenario. Let's say that at 65, you didn't have to take. Why? Because you had a large group plan available. And you decide to retire or go on Medicare at 67. All we have to do is we have to verify that you have or your spouse was working, covered by an employer-provided plan. So we had active employment, we had active group health insurance back to 65 with no gaps whatsoever. You had continual coverage back to 65. And the way we prove that is a form called an L564. And this is a request for employment information. Your HR department would fill that out, and they'll verify we've had active insurance, active employment. The L564 does that. And then the 40B form we have to fill out in this process just simply says we're going to end our group plan, say December 31, and we want to start Medicare January 1st. So on the 40B form, we would let Medicare know when we want to begin our Medicare benefits. So it's a very seamless transition, coming off the group plan and going on to Medicare with these two particular forms. All right, so that's the process, and that is using the special enrollment period. Now keep in mind, we want no gaps in coverage whatsoever in this period of time. All right, lastly, I'm going to talk about the expenses associated with going on Medicare. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. Now, the actual expenses will vary depending upon how you decide to use your Medicare benefits. And frankly, folks, there's really only two ways in which we use Medicare. One way is to enroll into Medicare A and B, and then get a supplemental plan to fill in the gaps that original Medicare does not cover. Now, I have lots of videos on the details of original Medicare A and B, but let me just quickly summarize. The A of Medicare is for everything that would be inpatient-related care, inpatient care. This would be hospitals, skilled nursing facilities for rehab. This would be hospice when someone's been diagnosed with a terminal illness. Those are the things, the healthcare services that are covered by Medicare A. That's the inpatient side. The Medicare B is the outpatient side of Medicare. This would be everything outpatient related, labs, MRIs, CAT scans, outpatient surgery, those kinds of things, plus all doctors that you see, whether you see them on an outpatient basis or they come to see you in the hospital. The B of Medicare always pays the physicians. All right. Now, as a general rule, when it comes to Medicare A and B, the A part of Medicare has zero premium. at all. There's no costs for most people as long as we've been working 10 years, 40 quarters they call it, where we've paid into Medicare taxes. There's no a premium for Medicare A. You've been paying it all your life, and so they give you Part A premium at no cost. Now B does have a premium, and this is $164.90 a month. Now, again, I'm shooting this video in 2023. This is the number that about 90% of the Medicare population pays. And the reason for this is because what Medicare does on the B side, they actually establish the premium based upon what is called your modified adjusted gross income. And on your tax return, that is line 11 plus line 2A. That's a tax-exempt interest. Line 11 is the AGI. So those two numbers together become your modified adjusted gross income, and that number is reported to Medicare, which then establishes your Part B premium. All right, now, so the way this works is if someone is a single filer, as long as their modified adjusted gross income is $97,000 or less, then that number is right for the premium. Now, if you're watching this video in 2024, it's probably going to be higher or lower than that. I don't know what it is yet, but it could be a little differently. Now, if you're a married who files a joint return, that number is $194,000 or less. Each of you then would pay $164.90. Now, if you're above those thresholds, then you're going to pay an additional amount for your Part B. And again, that's about 7 to 10% of the population, and that could be you. And so those additional amounts are called Irmas. I've got a lot of teaching on our YouTube channel about Irmas, but it's an acronym that stands for Income-Related Monthly Adjusted Amount. And so those Irmas are surcharges that high-income people pay for Medicare B as well as drug plans. Now, combined, those Irmas, depending upon your level above here, will be anywhere from an extra $80 a month, on the high side about $480 a month. And again, you're making, well over $500,000 if you're paying $480, but the point is people do have to pay those additional amounts. And again, that's something that you have to take into consideration. Now, especially if you have a group plan and it's 20 or more, going on Medicare sometimes is not the greatest value. But again, if you're on a group plan 19 or less, or you're 1099, you have to go on Medicare anyways. And with that high income, you're just going to have to live with the fact that you are going to be paying those extra Irmas. So remember, the Irma levels are only above the $97,000 or $194 as a couple. And what I'm trying to teach you now are the cost or the expenses of being on original Medicare. And so if I check this option here, I have A and B. A is 0, B has a premium, and then supplemental plans. Now, keep in mind, when we have a supplemental plan, the reason we get that is because of the financial gaps that exist in original Medicare. Financial gaps meaning you have these liabilities. So on the A of Medicare, we have 3 gaps, and on the B of Medicare, we have 3 gaps. Okay? And so these gaps just simply mean these are things that are going to be out of your pocket. They are deductibles. They are co-insurance. There's co-pays. There's a thing called an excess charge. But again, these are gaps. And the majority of people today that are getting gap policies or Medicare supplemental policies are getting a G plan or an N plan. The G plan covers 5 of the 6 gaps. You would be responsible for 1 gap. And the reason that gap plan covers the other 5 is because you're paying a premium to that insurance company for them to take that financial liability from you. But you are responsible for 1 gap only on the G plan, and that is called the Medicare B deductible. This year, that's $226 for the whole year. So we pay the first $226. After that, that G plan pays everything else. Medicare pays, G follows. It's almost 100% coverage, just not quite. Now the N plan, another popular plan, pays for the 6 gaps. So the N will not, just like the G does not, it will not cover your small B deductible. That's the $226 this year. And the N also will not cover what's called excess. This is when a doctor adds to the bill. A lot of doctors do not add to the bill, some do, but when they add to the Medicare bill, they can legally add 15%. And so that's called an excess charge, and that 15% would be your responsibility. And so if you have a G plan covers excess, N plan does not. And again, not every doctor does this for sure, but those that do, you would have to pay out of pocket. And so the difference in premium here is on the average about $30 a month, okay? So those G plans right now are ranging about $125 a month. N plans are going to be about $90 to $95 a month. So you just have to decide if it's worth the risk to you to take on excess. Now, I could tell you right now, I guarantee you, I would take the G plan. I want no surprises. I don't want to have to worry about any excess charges. Plus, with the N plan, every time you see a doctor, you're subject to a $20 copay, or a specialist $20 copay. And so I just wouldn't like that. And so the extra $30 a month would not be a big issue for me. I'd rather pay that and never have to worry about anything other than a small B deductible once a year. But again, both are very good plans, and these are the top two plans today. But my point is this: we have to pay Medicare, our B premium. We have to get some kind of a supplemental plan, and then in this scenario, we're going to add a drug plan. I'm not going to go into it a lot right now, other than to say average drug plan right now is probably about $25 a month. And so what do we have? Let's say we had a G, 125, drug plan 25, so I'm at 150, I'm at 165, we'll call it. So what are we at here? We're at $315 a month, and we have some copays for our medications, but other than that, we're pretty well done. We got that small B deductible, so $315 a month is going to cover it. Now again, if we're high income above $97,000 or $194 as a couple, we're going to have those additional charges. But that's one way that we can use our Medicare. Okay, so that's that way. And that's about what half of all people do. The other half of people today are actually enrolling in Medicare A and B, which means we're still paying our B premium. We got the $164.90, but what we're doing now is we're getting a replacement plan. These are called C plans or Advantage plans. And again, this is about half of what the other part of the Medicare population is doing. They're enrolling into a C plan. Now with the C plan, I'm still paying Medicare, but there's no premium to the insurance company, there's no premium for my drug plan. And so why is that? Well, because on the Advantage plan, I just pay as I go. And so I have a series of copays. Go to a specialist, pay a $50 copay. Go to the hospital, probably $350 a day for maybe 5 or 6 days. Have an outpatient surgery, copay of probably $250, $300. Have an MRI or a CAT scan, copay of maybe $200. But it's a pay-as-you-go system. Here, I paid premiums. Over here, I pay Medicare, but beyond that, I just pay as I go. And then these plans, whether you have an HMO or a PPO plan, they're going to stop somewhere at about $5,000 to $7,000 a year out of pocket. Those are called max out of pocket. So every plan has a max out of pocket for that year. So our copays apply to the max. If I ever hit the max, then I'm done paying anything, and then they'll reset every January, and then I start paying again. And again, there is no right or wrong. It's just these are your two different options. So the expenses will be here. I got to pay Medicare, and then I pay as I go. So I'm basically taking on the risk of whatever healthcare services I may need. I don't know what those are going to be, but some are willing to take the risk. Others say, no, I don't really want the risk. I just soon go ahead and get a supplemental plan and have no surprises. So again, those are your two options, and those are the expenses. Now keep this in mind. If you're high income, whether that's above 97 or 194, then you're still going to pay that additional amount, that $80 to $480. And so when you are turning 65, you're going to have to decide. Sometimes people are even in a large group of 20 or more, and it even makes sense for them not to stay on a group plan because the financial aspects of that group plan are really not that favorable. So my encouragement to you is if you do have a large group of 20 or more, you don't have to do anything with Medicare, but you still ought to make the comparison and compare those two options to decide which is going to be in your best financial interest.